There are criteria by which we decide whether a patient can have different types of treatment. So when somebody comes in, we measure their height and weight, and that puts them into a BMI category, so that's body mass index. And so we look at whether they sit in the overweight range, that's BMI 25 to 30, whether they sit in class 1 obesity, which is a BMI 30 to 35, class 2 obesity 35 to 40, and so on. It goes up from there. In essence, to qualify for the keyhole bariatric surgery, you generally have to have a BMI over 35. We can do patients less than 35, so in that class 1 range, but they have to have significant obesity-related comorbidities. By that I mean things like significant type 2 diabetes, not controlled on medication, sleep apnea, these types of problems. For some of the non-keyhole treatments, so the endoscopic treatments such as intragastric balloon, endoscopic sleeve gastroplasty, or medication, we can use those treatments at a BMI between 30 and 35, and sometimes with the medication even in the overweight range. So we're guided by numbers which allow us to put people or risk stratify them in terms of the risk that their obesity gives them. We're also able to treat people based on what health conditions they currently have. So there are some strict guidelines around things, and each and every patient that we see, we examine all of those things and decide what's most appropriate for them.